Well, we have a couple fine gentlemen from Freedom Village here with us. One, you know, Joel Niblett, and he is the administrator for Freedom Village Healthcare Center right up there in Lake Forest on El Toro. Nice to have you here again.
Thank you.
And you brought along a guest, and your first time here, Dr. Michael Haga, and you are the medical director for that facility. Nice to have you on.
Thank you,
Good
sir.
to meet you.
Good morning.
And Freedom Village, I know we've talked about this before. Most people, I think, when they first hear of it, they think of it as a nice place to live, great facility. You offer a whole lot there, but you're really so much more than that, aren't you?
We absolutely are, and we refer to ourselves as a continuing care retirement community. So we offer independent living, assisted living, and skilled nursing all in one location. Mm-hmm. So there's a lot of benefits to that, of course. When they come to us in the independent living, we can graduate them through the assisted living into skilled if they need be. And it's really important to note that our skilled nursing and our healthcare center is open to the public. There's kind of a misconception out there that it's exclusively for Freedom Villagers, but it's not. So we do work with all of Orange County to accommodate any residents that might be interested to coming to the assisted living or skilled nursing.
And you have talked about that in the past, that often you will have people who do not live there, but they may come up there for a set length of time to recuperate, to get therapy and things like that, and then once they get past that point, they go back to wherever else they may be living. So it's a great benefit. It really is. It's not just it's a great place to live, of course, but it's not just that. You offer so much more. And Doctor, tell us about your role as the medical director there.
You bet. Don't tell Joel, but my job there is actually pretty easy. Joel has done such a darn good job with his staff, whether it be activities director, physical therapy, food program. They bring me often very detailed, thorough reports. They're doing their homework, so I kind of look over what they're doing and sign off on it. So it hasn't been that hard. Occasionally I have to get a late night phone call. Perhaps another physician will return a phone call and a nurse has to call me. So I'm there. Basically, I enjoy what I do. It's a great place to be a medical director for, because they're just a well-oiled machine, if I may say so.
Yeah, it is. And Joel, tell me about your specialized programs. You've brought on different folks in the past, and each one kind of fits into a certain specialty, and there are many of them. So please tell me the different ones that you have.
Sure, I'll be glad to share. First, I want to note that we have an orthopedic physician that rounds weekly in the skilled nursing, and that's Dr. Roble. He's been a guest on here before. He's an orthopedic surgeon. And in addition to that, we have we call it coordinated comprehensive care, where when someone comes to skilled nursing post their knee or hip surgery, and they're with us for a while, then we can offer to them what's called the Bridge to Home program. The Bridge to Home program is where they graduate from skilled nursing to the assisted living, and a lot of times when people, when they're finished with their therapy, they generally go straight back home. They're typically okay with the therapy, but if they're alone by themselves and they want to build their confidence, then we take care of them in our assisted living for 3 to 5 days, manage their medications, and make sure that they're really comfortable and confident going back home. So, and we also have respite care that we provide in the assisted living for anyone that might want to come for a week or two. Usually it's a husband and wife, or if the parent is living with the kids and they need to go somewhere on a trip. So we offer those types of services to the community. Yeah, it's actually, it's quite popular, and it's becoming more popular.
Yeah, I think that is a great service. And how is that something fairly new that you've had?
Well, we've been doing it for quite a while, but I think that as the Orange County and the specific the demographics that we have and the population that we serve here, there's a growing demand and a need to have that type of service, and we're finding more and more that it's being utilized.
Yeah, that is really good. What is a couple things, Michael, that you can share with us about selecting a skilled nurse for short-term therapy, even long-term therapy, and how would you go about it? Someone that may need that service.
My first recommendation is a lot of you have a choice when you leave the hospital. They give you often a list of nursing homes to choose from. I recommend that they tour them. They need to get a feel for them,
Okay.
meet people. Once you have chosen one, I do want to really recommend that they get involved. Go meet the director of nurses. Get their name. If anything goes wrong or they have any concerns, you always want to have someone to be able to go to. And I would also recommend they get involved with the physical therapy. If there's a loved one there, for me personally, a lot of my patients are very geriatric. A lot of them have memory loss. They can't necessarily speak up for themselves.
Yeah.
So it's really good for a family to get involved and help be their voice. Participate in a session of physical therapy so they can be ready for when they're coming home or wherever they're going to be going to. So get involved is my main thing.
Like doctors and other specialists, is that true when it comes to skilled nursing, that there's certain fields in nursing that they really hone in on? And in one of the cases here, of course, would be certain types of occupational therapy or whatever it may be.
Well, I would like to share at this point that something that's unique to Freedom Village is that in our skilled nursings, we actually staff registered nurses or RNs around the clock 24 hours a day. And then also in our assisted living, we have licensed nurses around the clock. You won't always find that, and we do that because we want to make sure our residents are well cared for. We want to be able to provide to meet the needs of a higher acuity residents or all the therapy residents that are coming to us. And we also have special, we have private rooms and private settings if people want to participate in that. And then we also have a unique relationship with a couple of hospices, Seacrest and Vitas, where we do general inpatient hospice care. So, so we do.
So you really offer a lot.
We do offer a lot.
One more thing here.
Sure.
And I would say 99% of nursing homes across the country, they all take care of people with memory loss and dementia. Okay, it's ubiquitous.
Yeah.
So many times those folks struggle in a nursing home because they are out of their element. And
Yes,
many
they are.
times they're confused, they don't know where they are, they don't remember that they had a surgery. They'll often try to stand up and fall. And Freedom Village has implemented something that very few people have so far, and I hope more people adopt it. And they've gotten rid of these alarms. So the standard practice right now is people take, who are confused, the nurses will often put them in front of the nursing station so they can observe them better, but they'll put an alarm under their seat. So if they stand up, the alarm goes off. And then, so you have to imagine what it's like to be in their world. They don't know where they are.
Yeah.
They might have pain. They try to stand up to go somewhere, and this horrible loud alarm goes off. And then 5 nurses rush at them and say, "Oh, sit down, Mr. Jones, sit down." So Freedom Village has been very proactive, and they've gotten rid of all the alarms in their building. And they've trained all their staff members to be alert and paying attention all the time.
Yeah.
And we've had this now for a quarter, and and the falls have either stayed the same or gone slightly down.
They've declined, and if I can add to that a little
Please.
bit, Dr. Haga, is we call it Purposeful Rounding. It's a program put out by Center of Medicare and Medicaid Services, CMS, and it's designed to be proactive and not reactive to care. So we actually go and we talk to the residents. Do you need something? Anticipate what their needs are, and we monitor them in such a way where we don't need the tab alarms. And it's linked to a sleeping program. So the longer they sleep, the less likely that they're going to have a fall in this case, since we're talking about it. And so it's a really exciting program, and it's really cutting edge. And I hope that it grows throughout the industry.
It's a less need for anxiety medication many times. I mean,
I think it's great.
It's a great program. I'm trying to encourage as many other places I go to please consider it. So
Yeah, and let's mention, obviously, you're talking about what you have for therapy and other medical needs, but let's talk briefly just about people want to go there and live. It's a wonderful environment, isn't it?
It is. So Freedom Village on the independent living side, they can come and enjoy all of the amenities that we offer. And you know, it's a village. It's people come and they thrive there. So they come to a community like ours versus being in their home or alone. They can come there. They build relationships. We have outings. We have aerobics in the pool, water aerobics.
Great food. We've heard about
Great
their food.
And we are going to have Chef Hugo, the amazing Chef Hugo, is going to be with us here next month.
Oh,
so you'll
good.
get a chance, and maybe we'll bring a little dessert for you to
Thank
sample.
you very much. I would
So-
appreciate that.
but
That's great.
Yeah. So definitely people can come and they can thrive at Freedom Village.
Very good. You offer, as you can see, folks, just a lot of different services there, every single level that you may need. Maybe you just want to go over and check that place out because you may need it one day, whether or not you choose to live there or you may need some therapy. It's right up the road at El Toro, and it's up there in Lake Forest. I pass by it every day on my way home. And if you don't know where it is, most people know where El Toro meets are, on, you know, where that big red barn is, and it's right across the road from there, on the same side of the street, but across the side street. So you know where it is. People are welcome to take tours up there, right?
Absolutely.
And then
Anytime.
it gets in their mind, and they know of what a great place, and if they need it, it's there for them.
We encourage them to come by and visit.
All right. Thank you both. Nice meeting you, Joel.
you.
We'll see you again soon.
Thank you.
Take care. Looking forward to Chef Hugo, too.
Okay.
All right. We'll be back.